I had a patient tell me, Doctor, I'm barely eating, I'm on Ozempic, but I feel awful and my weight loss is slow. Here's the thing on GLP-1 medications like Ozempic or Mounjaro. It's not just how much you eat, it's what you eat. Since GLP-1 medications suppress appetite so effectively, it matters what you eat so much more than you may think. Some foods will actually make your side effects worse, slow your progress, and even stall your weight loss. So let's go through 7 foods you should avoid on GLP-1 medications and what to eat instead. And you don't want to miss number 4. Hi, I'm Dr. Bazgha Khalid, and I'm a board certified internal medicine and obesity medicine specialist. And I prescribe GLP-1 medications all the time in my clinical practice for weight management as well as for treatment for type 2 diabetes. Remember, GLP-1 medications slow down your stomach. They reduce hunger and they help you feel full faster. So now your body is in a very different state. And if you eat the wrong foods, the food sit in your stomach longer, cause nausea, bloating, acid reflux, and constipation. And you end up eating less of the good stuff. That's where the problem starts. Let's talk about foods to avoid on GLP-1 medications to avoid side effects and to help these medications improve your metabolic health and weight. Number 1 food to avoid is fried and greasy foods. Now, this is an obvious one. Fried food, fast food, heavy, greasy meals are a no-go on GLP-1 medications. Remember, while on GLP-1 medications, fat digestion is slower. So when you eat something like fried chicken or fries, it just sits there in your stomach. And patients tell me, I feel nauseated for many hours. So fried and greasy foods worsen nausea, delay stomach emptying even more, and reduce your ability to eat protein later. So instead of fried and greasy food, better options will be grilled, baked, air fried versions. So instead of fried chicken, have grilled or baked chicken. Same food, however, healthier and a very different outcome. Number 2 food to avoid is sugary drinks and liquid calories. This one is sneaky. Soda, juice, sweetened coffee. You don't feel full from liquids. So even on GLP-1 medications, you can still consume a lot of calories without realizing it. And here's the kicker. These liquid calories spike your blood sugar and then crash it, which can increase cravings later, and your overall calorie count goes up and stalls your progress on GLP-1 medications. So better options will be water, sparkling water, and unsweetened tea or coffee. This simple switch can have a big impact. Number 3 food to avoid is ultra-processed snacks. Chips, cookies, packaged snacks. These are designed to be easy to eat even when you are not hungry, as they're hyper palatable and very addictive. And on GLP-1 medications, you might eat less quantity but still not get enough nutrition, as these ultra processed foods are very low in nutrition and heavy on calories due to sugar and fats. So now you are low on protein, low on nutrients, and still craving more. So better options will be real food snacks like Greek yogurt, eggs, and nuts in controlled portions. Number 4 food to avoid is high fat plus high sugar combos. High fat and high sugar is the worst food combination. Think of foods like desserts, pastries, ice cream. Fat plus sugar together equals very calorie dense food, very addictive, and it becomes really hard to stop eating these foods. And on GLP-1 medications, this combination of fat and sugar often makes people feel really sick with nausea, bloating, and even vomiting. Clinical reality is that most side effects I see in my patients are triggered by these high fat and high sugar combination foods. Therefore, best to avoid these as much as possible. Number 5 food to avoid is large portions of refined carbohydrates. White bread, white rice, pasta. Now, these aren't bad foods, but large portions, that's the issue, because refined carbohydrates digest quickly, spike blood sugar, and don't keep you full even on GLP-1 medications. So cravings stay high and you eat, more and more without even realizing the fullness signals on GLP-1 medications, and you end up getting bloating, nausea, or even vomiting. So better approach is to avoid refined carbohydrates as much as possible. Eat smaller portions if you desire and pair with protein and fiber. Examples are, instead of a big bowl of pasta, go for a smaller portion of pasta with chicken and vegetables. Number 6 food to avoid is alcohol. This one is underrated. Alcohol on GLP-1 medications can worsen nausea, increase dehydration, and lower inhibition, which means poor food choices. And it adds calories very, very quickly. Also, many patients say their tolerance for alcohol changes on GLP-1 medications and they feel worse with even less alcohol. So best approach is to avoid alcohol if possible, limit use if you really desire it, especially early on GLP-1 medications. Number 7 food to avoid is so-called healthy high-calorie foods. This surprises people the most. Things like nuts, granola, protein bars, heavy dressing. Yes, they are quote-unquote healthy, but they are very calorie dense and easy to overeat, even in small amounts. So you think you're eating light, but calories add up fast. So better strategy is portion control and prioritize protein first. Quick question for you. Which of these foods surprise you the most? Or which one do you struggle with the most? Let me know in the comments. I actually use your comments to plan my future videos. A lot of people think I'm eating less, so it doesn't matter what I eat. That's not true because your body, while on GLP-1 medications, has lower appetite and fewer eating opportunities. So every bite matters more. This is your chance to get it right. GLP-1 medications are powerful. Clinical trials show significant weight loss, but the best results always come with better food choices. Not perfection, just better decisions most of the time. Focus on protein, whole foods, and simple meals. That's it. Now, talking about simple meals, I'm creating a series of videos for meal prep ideas, and I'll appreciate if you can let me know your favorite high protein meal prep ideas. This will help me brainstorm my next videos. If this video helped you, hit like and subscribe because I break down weight loss in a way that actually makes sense. No confusion, no fluff. And in the next video, I'm covering something everybody asks me: what to eat in a day on Ozempic or Mounjaro. Just simple, realistic meal ideas. Stay healthy, happy, and well. See you in the next video. Bye for now.